I'm going to start with Thermi, and Thermi has changed. There's a much more powerful Thermi unit, and what's interesting about it is that we can get to temperatures much faster, much more safer for our patients, and we can get some very nice tightening, whether we do Thermi tight or Thermi smooth. This is with needle-assisted Thermi, so you're putting a cannula in, or you can do Thermi just superficial on the skin and get some very nice contouring and tightening there. EndyMed, it's a little bit different of a system in that it uses different electrodes to actually penetrate a little bit deeper than some of the other systems. And again, there's lots of different hand pieces that allow us to do some really nice body contouring and skin tightening. So we're getting to the world of hands-free. This is not yet in the US. It's in the rest of the world. It's called Accentuate. You put this on, it's a 40-minute treatment. You can put 2 or 3 pads on, and you leave the room, and the patient does exceptionally well with this. This is a drug called Xiaflex. It's been shown that if you inject this material, which is collagenase, into cellulite goes away. They just released some data, so I wanted to share that with you. 2 identical phase 3 studies looking at cellulite in the buttock region. And again, they had 845 women were involved in these trials. They got up to 3 treatments. The treatments were done 21 days apart, and everything worked. Statistical significance in improving cellulite. This drug is still several years away from clearance. It's by Endo Aesthetics. It's an exciting drug, whether we treat buttocks, and we'll get into thighs and other areas as we move on.
People have heard me say this. Patients want these days no surgery, no pain, no downtime, no compression garments, no scarring, bruising, swelling, no signs of having had treatment, immediate results, lasting results, reasonably priced, free if possible. So I always feel like I need a magic wand. So I'm finding now that radiofrequency assisted lipolysis is getting close to being that answer to meet all of those needs for what patients are looking for. It's minimally invasive, it minimizes the scarring, it's much less downtime than other types of lipolysis or liposuction. It reduces bruising, it's less expensive, there's no general anesthesia, there's results that are approaching surgical results, and it can be combined with liposuction or other procedures to give us really optimal results. So this is the handpiece for the face-tight device, and you can see that there are 2 probes. There are thermistors both in the external and the internal probe. The internal probe is actually a cannula that goes into the skin, and it has a plastic protector to stop you from burning the skin or accidental skin perforation. So what you have is these 2 probes which communicate with each other, both emitting heat, and as they are advanced over the skin, they both emit heat. The temperature stays pretty comfortable externally, somewhere around 38 degrees externally, but internally you can get much, much hotter. And what you see is immediately you get about a 30% contraction of the skin, but deep down, what you're getting is lipolysis of the fat. Now, similarly, they have a different handpiece, which is for the body, and the Body Tight uses a slightly larger handpiece externally, so more thermistors externally, so you can cover a larger surface area, and again with that same cannula inside. So this is key because what you have now in terms of scarring is only a puncture wound that's about the size of, or the diameter of a spaghetti noodle. But one of the biggest problems with liposuction is the contour deformities that can persist. And we combine these 2, we're seeing that the contour deformities are much, much less. So we've always combined liposuction with radiofrequency in order to give the best, the immediate correction and the long-term correction, or ultrasound-based therapy with radiofrequency for long-term therapy versus short-term therapy. This is one treatment that we're seeing these types of results, and we will combine it with liposuction, but the contouring has become really superior, but it's doing such a nice job, and it's kind of revolutionized everything in terms of body sculpting in our office. And so I've asked my husband to start at the top and go to the bottom. So next year in Nashville, when you all see me, if I look like this, don't worry about it, okay?
So I'm going to talk about cutaneous shockwave therapy. And when I think about body contouring, where we've come from RFs and ultrasound and lasers and light-based sources and low-level light, now to shockwave therapy. And body contouring, as we know of it, includes the treatment of cellulite. It's gone on now to female vaginal rejuvenation and even erectile rejuvenation. So I'm going to talk about cutaneous shockwave treatment in this arena. And so when I first learned about this 2 years ago, I was like, you got to be kidding me. And then I started looking at the literature, and the literature is rampant with really high quality studies, and they're all in urology at this point. And what I took was, I took a bunch of different studies, and then I put together this particular study to show you, because it's the one that clinched it for me. This is a paper published in 2017 looking at 7 studies, which this low intensity extracorporeal shockwave therapy was used versus sham in over 600 people. Some of these people had respond to oral agents, others actually had not, but the majority had the vascular form and not neurogenic erectile dysfunction. They all had identical treatments throughout all these studies, and it's how we do it now in our office. They're treated twice a week for 3 weeks. They then go 3 weeks without treatment, and then they have 3 more weeks of twice a week treatment. And then they're evaluated by the scale, which is very commonly known in urology, which is the International Index of Erectile Dysfunction. It looks at everything from hardness to how long the erection is for, to how good the quality of the sex is, and all these people showed statistically significant improvement after that second series of treatments. It lasted up to a year, and there were no significant adverse events, and frankly all we get is a little bit of swelling and sensitivity, and Michael showed the Strat Pharma products, and we put a little silicone gel on the area. It's totally harmless, and so this is a new approach. It's going to be controversial for a while. People are going to ask why dermatologists are treating these people, and I can tell you that the people we treat are not necessarily the people the urologists are treating. We're not treating really sick people. We're often treating guys who simply want better sexual performance. We're starting to run a bunch of courses now to teach this through CME because of all the problems with the FDA and the vaginal devices. The same thing is going to apply to this group. They're all off-label. This one's in LA. There'll be one in New York and one in Chicago in the spring.